Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
So, drugs which undergo acetylation. Drugs undergo hepatic acetylation are. So, we have sulfonamides. The drugs like sulfonamides, hydralazine, isoniazid, procainamide, that is ship drugs, which is sulfonamide, hydralazine, isoniazid, procainamide. These will undergo acetylation. Acetylation actually it is um, the acetylation mainly depends upon the individual genetic makeup. Based on the individual genetic makeup, we have fast acetylators are present, and we also have slow acetylators are also present. So these fast acetylators and slow acetylators will produce both side effects, and based on the fast acetylators and slow acetylators, the side effect profile of these drugs will differ. So as a result, pharmacogenetic testing should be done before we give these drugs for these patients.
thank you and thank you for watching.